In this segment, let us look at the causes of mental illness. Often, it is not possible to pinpoint one specific reason for a person to develop mental illness. In most of the cases, various causes are identified and it is multifactorial. Some people are vulnerable than others for different reasons. Now, I am going to list out the different causes for developing mental illness. The first and foremost factor is genes. We all have two different types of genes, good genes and bad genes. All types of genes are transmitted from one generation to the other, and therefore we can inherit those genes from our parents. Now, genes are not only responsible for things like our body color, color of the hair, etc., but they also have a tendency to pass illnesses, physical illnesses and mental illnesses from one generation to the other. So, when people have mental illness, they often have a family history where their parents, grandparents and cousins have some form of mental illness. It is sad that they have inherited these faulty genes from their previous generations and now they are expressed, leading to some form of mental health difficulties. It is not only for mental illness, even in terms of personality. Okay? People have good and positive type of personality, negative types of personality. These personality traits are also inherited and transmitted from one generation to the other. The next important factor is chemical imbalance. Now, a lot of research have been done throughout the world identifying the cause for different types of mental disorders. We now know that chemical imbalance plays an important role in the development of various psychiatric disorders like schizophrenia, bipolar disorder, depressive disorder, and anxiety disorders. Chemicals like dopamine, serotonin, all these play a significant role, and when there is chemical imbalance in the brain, these can lead to different types of mental disorders. The third important factor is life events. Negative life events and stressful life events, for example, relationship breakdown or financial worries, all these can have significant negative impact on psychological health and therefore can cause mental disorders. Similarly, traumatic events like flood, fire, earthquakes can also affect the psychological health of the people, and it can affect their mental state and can lead to mental health disorders in the long term. Next important factor is hidden feelings. It is important that we express our feelings appropriately and don't suppress them. A lot of people tend to suppress their feelings, and this can affect their psychological health. It is important that you express your feelings openly and honestly, and if you don't do that, in the long term, it can lead to psychological problems. The other important factor is difficult upbringing and family background. The important points to bear in mind is harsh and strict parenting, overprotective parents, childhood neglect, and abuse in the form of physical abuse, emotional abuse, and sexual abuse. All these can affect the psychological health of people and in the long term can lead to psychiatric problems. The next important factor is alcohol and recreational drugs like cannabis, cocaine, etc. People get hooked on to drinking alcohol and taking recreational drugs, and they become addictive. In the long term, it not only has a negative impact on their physical health, but also their psychological health will be affected, leading to psychiatric problems. It is important to bear in mind that sometimes medical drugs can also cause psychiatric problems. For example, if you take steroids, corticosteroids in the long term, it can either make you feel low in mood and become depressed, or sometimes you can become overexcited and manic. So there are some medications which can also precipitate psychiatric problems, and it has to be consulted with the doctors before you take medications. As you may know, our body and mind are interconnected. Whenever there is a problem in our body, it can also affect the mind. So when people have physical disorders, say for example thyroid disorders, if you have an underactive thyroid or overactive thyroid, in the long term this can cause psychiatric problems. Similarly, people who have diabetes, more than 50 to 60% of patients who have long-term diabetes can develop psychiatric problems like depression. Other important medical disorders that can cause psychiatric problems include heart diseases, cancer, stroke, and Parkinson's disease. Another important factor is head injury. People suffer from road traffic accidents and other forms of accidents where they sustain significant head injury. So when people have traumatic brain injury, they can develop personality deterioration in the long term and also develop different types of psychiatric problems. The next important vulnerability factor is pregnancy and childbirth. If mother suffers from some illness during the pregnancy period, that is a risk factor. If there are complications for mother and the child around the time of delivery, that is also a risk factor. Premature births in the child is another risk factor. All these can lead to developmental disorders in childhood and mental retardation and long-term psychiatric problems. The next important factor is being sociable. Research have shown that people who have less friends and people who have less healthy relationships are more prone to develop mental distress and mental health problems in the future. But if you have a highly sociable life and good coping skills, then you are less likely to develop any mental illness in the long run. I have mentioned a number of different factors which can make someone susceptible and vulnerable to develop mental illness. Like I mentioned earlier, it is often multifactorial. But please bear in mind, in many cases, we don't know exactly what causes mental illness and the exact cause cannot be identified.